we're going to talk about as a possible red flag for low back pain has to do with your hip flexors. So one muscle that actually plays a really big role in flexing your hip is the psoas. Now the psoas, as you can see, actually starts and it attaches to your spine and it makes its way down the pelvis and inserts right here onto your hip. Okay? Now, some people who have low back pain and they feel that tightness in their hip, if you feel like you have tightness in your hips and you have low back pain and you try to stretch that out, you find that that actually helps to relieve some of your pain that you have in your low back. A possible reason could be you have tight hip flexors. So how do we know if we have tight hip flexors? In this next video, I'm going to show you how you can test to see if you have tight hip flexors and possible things that you can do to help to alleviate those tight hip flexors. So a common test that we actually use here in the clinic to determine if you have tight hip flexors is a test called the Thomas test. But the Thomas test doesn't necessarily have to have a chiropractor or physiotherapy in the room. You can actually test your hip flexors on your own. And here's a simple way that you can do that. So if you were to lie down on your back onto a table just like so, have one leg dangling off the table and the other leg is bent and held with your arm and you pull, you're looking to see if your leg can stay flat on the table or if it actually will lift up just like it is in this situation here. If it stays flat on the table, it usually means that your hip flexors are loose enough. But if you find that it tends to lift up off the table, as this leg is coming up, so the opposite leg that you're holding lifts up off the table, it's usually a sign that your hip flexors are tight. And that could be a possible reason why you're having your low back pain.